Well, I appreciate everybody coming to an event like this. I can't say that this isn't exactly a titillating subject, but it is something that every single person who is approaching Medicare eligibility really does need to know, because if you make a wrong move, it could haunt you for the rest of your days. So hopefully after we're done here, you guys are going to be experts and you guys can just go out and help your friends. So without further ado, we can get started. All right, so there are 4 parts of Medicare. There is A, B, C, and D. And so A, if you have a Medicare card already and you're using your original Medicare, you would see that in parentheses it says hospital next to A. So in addition to paying for your inpatient hospital care, it also pays for some of those other things that are listed. Medicare Part B has medical in parentheses on your card, and it primarily pays the physicians, but it also pays for a few other things which are listed on the slide. C is just another name for Medicare Advantage. Really doesn't make sense, but I think they just had to figure out another part. So what Medicare Advantage is, you still sign up for original Medicare, you get your original Medicare card, but then you stick that in a safe place where you can go back and get it if you need to find it. But Medicare Advantage are just independent insurance companies that contract with the government to deliver Medicare benefits. And so we're going to get into the differences between Medicare Advantage and original Medicare in just a bit. But one of the things that you hear about Medicare Advantage a lot is that it covers a few extra things that original Medicare does not. And then Part D at least makes a little bit of sense. It's the drug plan. So these are, again, just private insurance companies that contract with the government to deliver prescription drug benefits to Medicare beneficiaries. You do not have to sign up for Medicare or a supplement or Medicare Advantage or a drug plan. But if you don't, you can incur some pretty hefty penalties if you try to come in down the road, or if you don't get some way to supplement what Medicare doesn't cover, you would incur some extra costs. So we'll get into that as well in just a second. All right, so when can you sign up for Medicare? You can sign up the 3 months before your 65th birthday, the month that you turn 65, and the 3 months after. If you are receiving your Social Security retirement benefits, you are going to walk to your mailbox about 3 months before your 65th birthday, and there your card's going to be. They automatically enroll you into Medicare if you're collecting your monthly retirement benefits. You can also sign up for Medicare if you're under 65 and you're disabled. And then there's an automatic enrollment after you've been receiving your disability payments for 2 years. So there is some lag time unless you have ALS or Lou Gehrig's disease. That is considered a presumptive disability, and as soon as you apply, you would get your benefits. And then you can defer signing up for Medicare and come in post your 65th birthday if you are covered under an employer group health plan or a union plan and are actively working, or you're the dependent of somebody who's actively working and covered under an employer plan. So there are 3 different enrollment periods for Medicare, and you don't want to mess up your enrollment period, or then you're in the 3rd one, and that's the one that you'd have a late enrollment penalty. So the initial enrollment penalty, or the initial enrollment period, or the IEP, is that period of time, the 7-month window, the 3 months before you turn 65, the month you turn 65, or the 3 months after. Now, your Medicare effective date depends on which one of those 7 months you signed up. So it's important to know when you want your Medicare to be effective. The people who have to sign up in this initial enrollment period is if you are not covered under an employer or a union plan. If you're just on your own individual plan, or just you and your spouse just have family coverage, you need to sign up at 65. The SEP, or the special enrollment period, only pertains to those people who are actively working. and are covered under the group plan, you can sign up whenever you choose. So if you decide, I'm going to work till I'm 70, then you would sign up for Medicare when you're 70. The rule is, as long as you're actively working, that's important. Because there's a form that you have to fill out. It's called the L564 form. And you take it to the Social Security office, and that is what proves to the government that you've been covered under this group plan since at least 65. And that's what waives your late enrollment penalty. If for some reason you didn't coordinate your retirement date with having your Medicare start right when that ends, then you don't panic, because you have 8 months from when the active employment ends or to sign up without the late enrollment penalty. Now, what I do have happen every once in a while is that people will just be busy and they'll say, I don't want to go to the Social Security office and sign up for Medicare right now. I'll do that later. I'm just going to take my COBRA benefits. And sometimes there's a good reason to continue your COBRA if you've already met your deductible and out-of-pocket maximum for the year. But the government only allows you to be on COBRA for 8 months. It's not creditable coverage. It's not the same thing as when you were actively employed. So if you elect your COBRA after you retire or you terminate for whatever reason, you got 8 months to sign up. And if you don't do that, then you end up in the general enrollment period. And so the general enrollment period are for those that fail to sign up during their applicable enrollment period. And if you have to come in at the general enrollment period, you have to do that between January 1st and March 31st of every calendar year. But your Medicare benefits will not start until July the 1st. So you've got to figure out how you're going to be covered. Now, you can get individual coverage through the marketplace. It's very expensive, but you could do that. Or if you still had, let's say you elected your COBRA and you forgot and you went over your 8 months, if you still, July 1st still was in your 18 months or 36 months that you were eligible for COBRA, then you would be okay. The late enrollment period for Part B is expensive. You know, sometimes you hear people will defer a Medicare drug plan, and there is a late enrollment penalty for that, but it's nothing like this one. So what they do is they look at how many full 12-month periods you were eligible for Medicare but did not come in. So let's just say it was a 30-month period. Well, you're going to get charged 10% for every full 12-month period, and that would be 20%, because that's 12 plus 12 would be 24. And those extra 6 months did not fulfill a third 12-month period. So though in a minute we're going to see the Part B premium chart, and if you had to tack on 10% or more to what you have to pay, especially if you're in a higher income bracket, it can be frightfully expensive. So we do everything in our power never to incur the Part B and late enrollment penalty. All right, so why in heaven's name would you want to delay Medicare? There's a couple of reasons. If you're covered under your employer plan and your employer plan is less expensive, because I just mentioned that the Part B premiums are income-based now. So for some people, especially if their employer plan is subsidized by the employer to a significant degree, they would have a higher monthly premium coming into Medicare. So if the employer plan is less expensive, that's one reason why some people decide to stay. If the employer plan is a high deductible health plan with a health savings account, I even encourage people to stay in those, because with the health savings account, there's all sorts of fabulous tax benefits that you have, and you can use your health savings account money when you come into Medicare, because those are those accounts that roll over from year to year, and if you have any funds that are left over from the current year, they just accumulate going forward. In 2018, the maximum individual contribution limit is $3,450, and any person who is 55 or older can put in an additional $1,000. And if you're on an employer plan, they're pulling that out of your paycheck and just funneling that into your HSA, so it's pre-tax money. If you are on an individual plan, That would have been a post-tax, but you wouldn't delay your Medicare if you're on an individual plan. But still, there's all sorts of fabulous ways to use your health savings account money when you come into Medicare, which we're going to talk about right now. You can use that to pay for your Part B premiums. The lowest a Part B premium can be in 2018 is $134, and the highest is $428.60. So you can use your HSA money to pay for that. You can also use your HSA money if you have a Medicare drug plan and you are also going to be charged a surcharge. You can use it to pay the surcharge. You can use it to pay your drug plan premium, and you can also use it when you pick up your medications, those co-pays. Any qualified medical expense, you can use your HSA money for. You cannot use it to pay a Medicare supplemental premium. It's not allowed for that. And one of the other nice things about an HSA is that if you took the money out for something other than a qualified medical expense, you're going to get a penalty of 20%, plus it gets taxed on top of that for ordinary income. After age 65, if you just have a lot of money in your HSA, and I have people that are in that situation, you can go ahead and take money out for non-qualified medical expenses. I mean, a trip, a gift, or whatever. And the 20% penalty goes away. It's just taxed as ordinary income. All right, so back to the Part B premium. The Part B premium is based on your tax return from 2 years prior. So everybody who's coming into Medicare this year, they're looking at your tax return from 2016, and they are looking at your modified adjusted gross income. If you're not sure what your MAGI is, I can tell you that. I have a little form I can give you.
Does it include your earnings from Social Security?
It is your AGI, and then it's taxable. Oh, wait a minute. Hold on. I knew somebody was going to ask. Here you go. You look at line 37 on your 1040 form, and that is your adjusted gross income. You look at non-taxable Social Security benefits, which if you have anything on lines 20A or 20B, you're going to subtract 20A minus 20B and get that figure. And then you have to add in tax-exempt interest. That's line 8B on the 1040 form. And then if you have excluded foreign income, then you have to add that in. So those four figures are what you add up for your MAGI. And you get that number, and then you figure out if you're filing singly or jointly, and you look at the chart, and that is what your monthly premium is per person. So if you are in an income bracket higher than the 134 level, then you also have to pay a surcharge, which is the next slide, in addition to the drug plan premium. So you've got your Part B premium that if you are drawing your monthly Social Security retirement benefits, that comes out of your check before they deposit it into the account that you gave them. And if you have a drug plan, remember we said you don't have to get one, but if you have a drug plan, they're also going to take out the applicable surcharge. So it can be very expensive for people sometimes to have a Medicare drug plan. So with my clients, we just look at it. It's a math problem to me. So if you are going to be in that highest income bracket and you're going to have to pay $74.80 a month in addition to your drug plan, and if you don't take any prescription drugs, or you just take a handful of generics that we can get you some discount coupons for to lower the cost of those medications already, then we defer, as long, if they feel good about that. Now, because you can always come into a drug plan between October 15th and December 7th of every calendar year, and it will start in January. All right, so now to Medicare supplements. Medicare supplements are really fancy. They're named for letters of the alphabet, and we've got A through N currently. The F plan is the Cadillac of all Medicare supplements, but the F plan is going to go away in the year 2020. They're not going to be allowed to sell it anymore. The F plan, I call it the 100% plan because it picks up 100% of your claim after Medicare pays its portion. So for your medical expenses, your premiums are your medical expenses because 100% of your claim is going to get paid between your two insurance policies if you have an F plan. There are deductibles to Medicare. So remember when I said on your Medicare card, if you have, there's A and there's B. So the government sets the thresholds for the deductibles every year. This year, the Part A deductible is $1,340. That is a significant deductible because it resets to zero every time you've been out of the hospital 60 consecutive days. But if you have an F plan, it picks up that deductible 100% of the time. There's also a Part B deductible to Medicare, and this year it's $183, and that's an annual deductible, so you only have to satisfy that one time. The F plan, if you have that one, pays your Part B deductible. And then for the physician side of it, when your claim goes to Medicare, it pays 80% of the negotiated rate, and then it picks up the remaining 20. So you just you should not have a bill. I tell my clients, if you have an F plan and you get a bill, you need to call me, because there's a couple of reasons why you might get one, but usually it's just a mistake. Yes, sir.
So I have two questions.
Mm-hmm.
On the F plan. You said it's going away in 2020.
Mm-hmm.
First question, will it be replaced with something similar? And the second question is, if you're already in the F plan, will you be grandfathered in?
Yes, you will absolutely be grandfathered in. Anybody who's already in the F plan gets to stay there if they want to, but what you need to think about is that they're not going to be able to add anybody to the pool. So those premiums are going to rise, in my professional opinion, more frequently and at a higher percentage. So what I'm advising my clients, if you're not with an insurance carrier that will allow you to go from the F to another one of their supplementals, because I like the G, which we'll talk about in just a second, without having to answer medical underwriting questions, then if you can switch to a G plan, you might want to consider that, because the G costs less than an F, but for some people, their carrier is going to require them to pass medical underwriting. It just depends on who you're insured with. The only difference between an F and a G is that you agree to pay the Part B deductible of Medicare, whatever the government sets that. So to put that in an example form, if you had to have a hip replacement or a knee replacement or a major diagnostic x-ray, the most you're ever going to pay in 2018 is $183. And after you'd paid your $183, you're done for the rest of the year. All your medical claims are paid at 100%, just like the F plan. And the reason I highlighted the N is becoming more popular. The N acts like the G, but you can be charged up to $20 for office visit copays. If you go to the emergency room, you're going to have to pay a $50 copay. If you're admitted, they'll waive that. But the N is of the three, I would at this point, depending on the carrier that somebody goes with, I would recommend a G. Okay. So who pays first? I just put this in there in case somebody already has, like perhaps Medicare Part A, but they're also covered under an employer plan. Coordination of benefits usually pops its ugly little head at least one time a year, and your claims stop being paid because the insurance company was like, hey, are we supposed to be paying first? Who's supposed to be paying first? So I just put this in there, and I'm not going to read that to you all, but if you have any questions about that, just let me know when we do the Q&A. Correct, and it's in there. So if it's 20 or more employees, Medicare is going to be secondary. If it's less than 20, Medicare pays primary. Okay, so the drug plans. Part D. We have 25 different Medicare drug plans to choose from in our area. We also have 16 choices for Medicare Advantage plans that include prescription drug coverage, and then we have 3 choices for Medicare Advantage plans without prescription drug plans. So people always say, well, how do I ever figure out what's best for me? It is based on your personal prescription list. So when I have couples that come to see me and they say, oh, but I want to have the same plan as my spouse, I'm like, no, you don't, unless you have the exact same list of prescriptions that you take monthly, because it's like a big Rubik's Cube. And what covers your prescription list the best is probably not going to cover your spouse's the best. So you would end up paying more if you were on the same plan. So we really try to tailor, at least I do, to your lowest out-of-pocket cost based on your personal prescription list. Okay, so Medicare drug plans, there's 4 coverage levels. If you have a deductible on your health plan, the highest a deductible can be this year is $405. Not all the drug plans will have a $405 deductible, but that's the highest it can be in 2018. So if you have a deductible you have to meet, then for some of the plans you don't get your best copay on your prescription medication until you have met your deductible. Once that deductible is met, then you're in what they call the initial coverage phase. And the initial coverage phase is typically when you get your lowest copay for your medication. And that initial coverage phase ends and you fall into the donut hole, if you've ever heard that phrase, or the coverage gap in 2018 when you and your drug plan together have paid $3,750 towards the purchase of your medications. So what they're looking at is the actual cost of your drugs, whatever that negotiated rate is between your drug plan and your pharmacy. Some drug plans have preferred pharmacies, and if you use those preferred pharmacies, especially if you're taking their a medication that's on their preferred drug list or a preferred generic or a generic, depending on what plan you have, you might pay nothing for your prescriptions. So if you've got one of those plans, that's great. If you slide into the donut hole, that means that you are going to have to pay more, typically, for your brand name drugs and even for some generics. It depends on what plan you have. Again, remember we have 25 to choose from. So for my clients, I feel like that's my job, to see if we can find one that helps you with your medication in the donut hole, if you're going to get there. In 2018, you're going to fall in the coverage gap if the actual cost of your medications total, if you take several, if they all add up and they're $312 or more a month, then in a full calendar year, you will fall into that coverage gap. You don't get out of the coverage gap in 2018 unless you have personally paid $5,000 towards the purchase of your medications. At that point, you fall into catastrophic coverage, and the cost of your medications go down to 5%. Of the full cost of the medication. So you can see a drastic drop in what you're paying at the pharmacy, but you would hope so after you've paid $5,000. But the takeaway is there's never a threshold at which your drug plan is going to pick up 100% of the cost of your medication, which if you're on an employer plan or even an individual plan right now, sometimes if your prescription costs go towards your deductible, as in a high deductible health plan, once you met your out-of-pocket maximum, your plan has to pay all your drug plan expenses. But that is not the way Medicare drug plans work. So it's a never-ending bucket of money. So it's great if you only take a handful of generic medications, because you're not going to fall into the donut hole. But if you take, like insulin is expensive on these Medicare drug plans, as are inhalers, any kind of drops for your eyes, those are usually very expensive. So, even just taking an inhaler and some eye drops every month, you're going to fall into the coverage gap. But the donut hole is going to end 1/1/2020. It goes away. So we'll just have to see what happens. I think we're going to see the premiums rise and probably the copay structure increase so that the insurance companies have a way to recoup some of that money. But we'll see. So this is just a visual that I have to try to help understand the difference between using original Medicare, a Medicare supplement, and a drug plan as opposed to a Medicare Advantage plan. What Medicare Advantage does is it rolls all three of those products into one thing. So instead of having three separate premiums, your Part B premium, because everybody pays for Part B. A is what you get for free if you've paid into the system long enough. If you're a dual eligible Medicare, Medicaid, then you would have your B paid for you. But for everybody, most people, I would imagine, in this room, you're going to pay your Part B. Then you're going to pay your Medicare drug plan premium. Remember, if you're in a higher income bracket, you would also have a surcharge if you want a drug plan. And then you're going to have your supplemental premium. So that's a lot of premiums that are going out the door. With a Medicare Advantage plan, you still have to pay the Part B premium, whatever that is to Medicare, and if you choose a Medicare Advantage plan that has a drug plan attached to it, if you are in the surcharge part of the Part B premium chart, you would also pay the surcharge. So a lot of times you'll hear people say, oh, I love my Medicare Advantage plan, I don't pay anything for it. It's not exactly true because you're still paying that Part B premium. It's coming out of your Social Security check if you're receiving your monthly benefits, or you have to pay quarterly to the government if you're not. So this is just kind of a quick study about what the difference is between traditional and Medicare Advantage, which we've highlighted just a bit. But as I said, you can have higher premiums with original Medicare because you're going to probably have those other items to go with it, the supplement and the drug plan. The main thing is that with original Medicare, Medicare is your network. That card gets you anywhere in the United States or U.S. territories to a provider who participates in Medicare. So you have much more freedom and flexibility to see who you want, where you want. For example, a specialty hospital like a Mayo Clinic, Cleveland Clinic, MD Anderson, you can get there with your Medicare card. With Medicare Advantage, you can have the lower premiums, but you have to stay in that plan's network. So it's just like your employer plan right now. If you are with Cigna or United Healthcare or Blue Cross Blue Shield of Tennessee, you're in a network. And so in order to get your best benefit, you're always striving to see somebody who's in your network. You would not be able to get to a specialty hospital on a Medicare Advantage plan unless you have out-of-network benefits. So those are some things that Medicare Advantage salespeople don't necessarily tell people when they're meeting with them, but that's important to know because when you come into Medicare, if you come in at 65, for whatever reasons, the government allows you to take a Medicare Advantage plan out for a test spin, so to speak, and if any time in that 12-month period you don't like your Medicare Advantage plan, maybe your doctor drops out of the network, or you've been diagnosed with the medical condition and you are going to the doctor a lot, because Medicare Advantage plans are copay plans. So you are paying a copay every time you are using your health insurance. So if you're not using it, then you're not spending very much money. But if you had to use it a lot, it could get pricey. So let's just say you were 65 and a half and you decided, I don't want to be in this anymore. You can go back and grab your original Medicare card and you could sign up for a Medicare supplement without having to answer any medical underwriting questions, because pre-existing conditions are alive and well in the Medicare universe. So when you sign up for Medicare in your initial enrollment period or your special enrollment period or even in your general enrollment period, you don't answer any medical underwriting questions. They can't ask you anything. But if you decided to switch Medicare supplements after you'd been enrolled in your Part B for the very first 6 months, if you were with original Medicare, you would have to pass medical underwriting. Some carriers have easier questions to answer and pass than others. It just depends. But it's very important that you make the best decision for you, because you may recall about 3 years ago, Blue Cross Blue Shield of Tennessee and Vanderbilt, at the 11th hour, they could not come to a contract negotiation for their Medicare Advantage plan, which is Blue Advantage. And I had about 20 people who came rushing through my office who were desperate to find something else that would include their physicians. So of the people who wanted to go back to original Medicare and a supplement, I only had 5 people that could pass the medical underwriting questions. So the best we can do is find you another Medicare Advantage plan that includes your physicians, or includes the majority of your physicians, or the ones that you want the most. So it's just more restrictive. So you need to know that going in. I'm not trying to say that Medicare Advantage plans are bad plans. They're great. I mean, the people who I help who love their Medicare Advantage plan, they wouldn't trade it for anything. But you just need to be aware of what you're signing up for and how that could impact you down the road. So what do you do now? You want to make sure that you sign up for Medicare during your applicable enrollment period, because remember, we don't want to get that Part B penalty. If you are already enrolled in Medicare, open enrollment starts October 15th and runs through December 7th. So if you have a Medicare drug plan, that's the time that you could look at your drug plan and decide there might be a better one for me for 2019. And you would enroll during that time frame, and it would become effective January 1st. If you're in a Medicare Advantage plan, you can change your Medicare Advantage plan between October 15th and December 7th, and it will start on January the 1st. But you do want to look at your plan and make sure you're happy with it, because after December 7th, unless you move out of your coverage area or move into a nursing home, you're not going to be making any changes until the following year during open enrollment. But if the same plan works for you and you're happy with it, you don't have to do a thing. So that's it. Frank, you're up.
Wow. Thank you. Really quick, want to thank you guys for coming out today. Thank you, Quinn Financial, for having us out. Really quick, I like to do a quick story on why I'm even here. When people think Social Security expert, they don't think of me. So I want to go ahead and tell you guys why I'm here and how I got here. And also do a couple of thank yous, because you guys will soon know Margaret was very pivotal on FedLogic and why I'm here standing in front of you today. But really quick, I'm from rural West Tennessee, from Brownsville. Anyone know where Brownsville is? Brownsville? Okay. I grew up in Haywood County. I grew up in a household where English was not our first language. My parents were immigrants to this country. My sister Alex, who is 2 years older than I am, was born with severe mental disability. Okay, so from a very young age, because my parents didn't know the language and I had a sibling that had a disabling condition, all I need to do is to help out where I can, just any way possible. Went to Haywood High School, went to Memphis from undergrad, came to Nashville in the early 2000s to pursue a career in law. All I wanted to do is work in public service, and I really wanted to work for the federal government. That's what I thought at the time. I spent almost a decade working for the Social Security Administration and with Medicare. I met a gentleman in Social Security who was good friends with none other than Margaret Smith. And we hit it off, and he was a very nice gentleman. He actually got diagnosed with a terminal cancer, and he walked through the doors at Gilda's Club, which, by the way, I was there this morning, and I told the same story. At Gilda's Club, he was introduced to Margaret Smith, because Margaret Smith is, of course, a Medicare expert, and he needed to get information there. She said to him, "I really wish I knew someone who worked with Social Security and knew the ins and outs." Well, he connected us. And to this day, we still go out to Gilda's Club and we do free seminars for them, because it's just the right thing to do. I wanted to work for the Social Security Administration, and I went there, and pretty soon after I started working there, I knew there's a lot of work to be done, and we're just not doing it the right way. Okay? The reason being is because in Social Security Administration, as a federal agent, you cannot advise a family on their benefits. Okay, which is a good thing. We don't want the federal government advising families on when to take their retirement, what to do with Medicare. I get it. But at the same time, you're at a complete disadvantage if you don't know what the benefits are to begin with. As a federal agent, when I was an adjudicator, all I could do is answer the question that was posed to me. I couldn't say, "Mr. and Mrs. Simmons, did you know that you could leverage your Social Security? You could do this with Medicare, you can do this." I couldn't do that, which I thought was Pretty weird because all I wanted to do was help, okay? Fast forward 10 years, I went from adjudicator to an analyst for the state. So I would take national policy, interpret it, and send it to all the field offices. And then from there, I became a congressional liaison. So I was the Mr. Fix-It guy with Social Security. If a constituent, you, would be so fed up at Social Security or at Medicare, and you knew to contact your congressman or woman, then they would call me up and then say, Frank, fix it. Was it the agent that dropped the ball? Was it the constituent that dropped the ball? Or was it miscommunication? What is it? So that's what my job was. And that's where I really knew that, hey, the Social Security Administration is doing a great job. They're trying to, but it's one of those things that you just don't know what you don't know. And they're not going to be able to tell you that. From there, I became a district supervisor for our district office here in Nashville. When I met Margaret, she said, hey, we need you to come help some individuals over at this big firm in Brentwood. And it was at that time that they said to me, you have something that you can provide us at this firm, and you need to provide it to everybody in the community. And that's what we did. I will give credit where credit's due because this is not my idea. If it was up to me, I would still be working for the federal government. It was my wife who said, you know what, if you're so frustrated and you take 10% of your week to deal with families who are upset at you or your employees, then let's do something different. It was her idea, her vision to bring our expertise out of the federal government, be able to sit with you guys and provide you the right information to understand your benefits, to maximize your benefits, and to execute them. And that's why we're here, okay? Luckily for us, we're now able to come out and present to you guys and tell you how the whole thing works. So I wanted to thank Margaret because you're a pivotal part of all that. So really quick, I'm going to get into it because I know we have question and answer that we want to get to. And I'm going to put the cameraman to work because I'm going to be walking around. Really quick, so every individual will retire. Every individual will need Medicare at some point. And statistically, 1 in 4 of us will become disabled during our working careers. Next slide. What we're talking about today, you already know why FedLogic is here and what we do. I just want to talk a little bit about the strategies about Social Security, why it is complex, and how we can navigate through it. Let's see. We'll talk about how we can, maximize our benefits under a spousal application type thing. We'll talk about widow benefits, disability, and a lot of this stuff we'll actually leave during our question and answer because I want to kind of get through to the meat of what I'm explaining. Let's go on to the next one. Really quick, Social Security works like this. 2 different distinct programs with Social Security. You have programs that you worked and paid into. Now, the word I'm about to use, I know it has a negative connotation in the political world. In Social Security federal government world, it just means that you worked and you paid into it and you will get what you deserve. Those are called the entitlement programs, meaning I worked and paid into Social Security and into Medicare. I'm entitled to this. It's not a handout, okay? Those are entitlement programs like retirement, survivors, disability, and of course Medicare. The other program that Social Security has is your needs-based programs like SSI, which is supplemental security income. Now, why is that important? Because I know most of us in this room have worked and paid into the entitlement side. Why is it important to understand there are needs-based programs? Let's go back to my personal story. My sister Alex, who was born with a severe mental disability, and for a lot of families who have a child with a disability who may not work or haven't worked enough to receive this program, we have the safety net feature of the SSI program that's also based around disability. Why is that important to you guys? You probably know a family who has a child who was born with cerebral palsy or with mental disability, that they need to understand that they may not get this program over here, but they can get this program here. And there's also a lot of overlap. My sister Alex, who receives SSI and Medicaid under this program, once my parents do retire, she will be receiving benefits under my father or my mother's record under this program. Okay? So it's really important to understand there's 2 very distinct programs or titles in Social Security, and that Social Security does not just affect those who are 55 or older or 65 or older. It is the entire age spectrum. Children who are born with disabilities have programs for them too. Okay? Does that make sense? We're going to talk about IRMA. You guys remember what we just learned about with the whole Medicare premiums. If you are at a certain level and you make your modified adjusted gross income is higher, there's actually ways to get that reduced. You have to have a life-changing event. That life-changing event or that information is under a form called SSA 44. If you are a family who is affected by increased Medicare premiums, look that form up. If I raise my hand as a tidbit you need to take away, SSA 44. The 44 will actually kind of walk you through, hey, you pay extra Medicare premiums based on your adjusted gross income. However, if you have a life-changing event like retirement, like marriage, like losing your spouse, then you can actually qualify and get your Medicare premiums reduced down. So it's really important. The other thing is cost of living increases. Those always come up during presentation. Just to let you know, those are passed by our boys and girls in Congress. So it's up to them on when they give that to us, okay? We had one for 2018 that was 2%, okay? Which is higher than the last 3 years combined, okay? So those will make your benefit increase. But like Margaret said earlier, it's about your timing and what you're wanting to do on when to trigger your benefits. Once you trigger them, they're pretty set in stone. And the only way it can ever go up is with a cost of living increase or if you continue working, okay? Let's go on to the next one. Really quick, one question that always comes up during my presentation is, hey, Frank, you work for Social Security. Tell me about this whole Social Security is running out business. I'm here to give you the sigh of relief that it's not running out, okay? It's not going anywhere, but you do hear that the solvency, meaning how much money we have in this pool, is only solvent through 2034. Now that's scary because it's 2018 and 2034 will be here before we know it. Why did that happen? Did someone steal from the trust fund? Where did that money go that we only have so much before it actually runs out? Well, first off, it's not running out. Right now they're paying 100% on the dollar. Come 2034, they can pay 79 cents on the dollar. Still a 21% hit, right? That is scary to think about. Scary for me too, thinking about retirement in the future. But the reason that that's happened, no one stole from the trust fund. What's happened is this pie chart. When Social Security was first started, there was about 5 American workers for every 1 person receiving benefits. You fast forward that to today, you have about 2.5 workers for every 1 person receiving benefit. You couple that with a recession that we had back in 2008, and you also couple that with our baby boomers who are coming in to file for their benefits at the tune of 10,000 people per day, well, then you have more money going out of the system than you have coming in, and then magically this 2034 figure comes into play, okay? Now, this is not to place blame on the baby boomers because you guys worked hard for these benefits. They're yours. But the big blue part is who's receiving the benefits right now, which are our retirees and their dependents, okay? Now, having worked with Social Security, having actuaries that we're still friends with up in Baltimore, here's what we know, okay? The 2034 year should be pushed out on its own for 1 or 2 years. Now, that's just a Band-Aid, right? It should be pushed out on its own because our economy is on the upswing and we have more people working and paying into the system, and our baby boomers are tapering off on coming in for their benefits. Okay, so 2 years on to the 2034 is going to happen automatically. But between now and then, some legislation is going to happen. Some administration is going to have to take this up and say, we need to continue to have Social Security for the long run. Now, what they may do is that they may raise the retirement age. Right now it's 66 for everyone in this room, 67 for the next generation. They may push it up. They may make it means tested. Whereas if you're still working, you're not filing. Okay, that's not the rule right now. Okay, right now, if you reach your full retirement age of 66, you can draw your benefit and continue working and make as much as you want. They may change that in the future. Okay, now, again, I'm not trying to scare anyone. That's just the reality of it. But they should fix it for the long run. Okay, any questions about the solvency of Social Security? No? You guys feel better about it though? Good. All right, let's keep going. What do you need to retire? You need to have worked at least 10 years because you need 40 credits. You get 4 for every year that you worked. So anyone who's worked 10 years will receive something from their Social Security retirement fund. Okay? What age do you need to be in order to file for retirement? This is where I like to, follow me here, cameraman. We like to use this as a timeline. Let's do it right there. Really quick, retirement. 62, right here, is the earliest that you can file for retirement benefits. The first month that you're 62, the whole month is the first month that you can receive a benefit. This is paid at 75%. As you walk and you keep going and you're not drawing your benefit's going up from 75% all the way here to 66, where you receive 100% of your benefit. Now, really quick, if you file this way, two things happen. You lock in your percentage rate, and if you're working, you can only make up to $17,000. So it's not much. If you make over $17,000, they charge you one for every $2 you go over. So anyone who's still working making well over $17,000, you're not filing for benefits anywhere this way. You're waiting till at least here. At 66, two things happen. You get 100% of your benefit, and that rule about the $17,000, that's out the window. That's gone. So if you're still working, loving what you do, when you reach 66, you have the option to take your benefit, and it doesn't matter to Social Security how much you're working or how much you're making. Now, you also have another option. You can continue going this way and not draw at 66. For every year that you wait beyond 66, Uncle Sam says, we're going to give you an extra 8% for every year that you wait. Okay? So 67, you get 108, 68, 116, and then you top out at age 70 at 132%. Now, no one should ever wait beyond age 70 to draw your Social Security benefit, okay? Because you're just leaving money on the table, okay? They always take the highest 35 years of earnings to compute your benefit amount. Even if you draw your benefit at 67 and you continue working, you're going to lock in your rate, but they take the highest 35 years of earnings to compute your benefit amount. Does that make sense? So the question I always get is like, well, if I draw my benefit at 68, do I still get charged Social Security and Medicare taxes? And the answer is yes. Uncle Sam wants his money. So yes. But they will recompute your benefit every year. So if you made more money in 2018 than you did back in 1994, they'll use that figure. Does that make sense? All right, let's go to the next one. There are three factors that Social Security is not going to talk to you about or tell you about. Okay, but they're very simple that we kind of developed to help families, at least on the initial level, on when to trigger my benefits, because that's primary question number one. The first one is need. Okay, now my definition of need is different from your financial advisor. Okay, my definition of financial need is, do you need your Social Security benefit to pay for something that you need to live with, like your mortgage or your bills? Okay, if the answer is yes, and you can draw your benefit, then that's where you stop. You got to draw your benefit. If the answer is no, the second thing you need to look at is health and life expectancy. If you have the option to not draw your benefit at 64 or at 66, do we have health and life expectancy on our side in order to justify the wait? Now, actuaries with Social Security will tell us if you don't draw your benefit here at 66 or at 64, on average, it takes 12 years to break even on your money. Example, if I'm 66 and I can receive $2,500 from Social Security, but I don't need the money, then I can draw it later and get 108% or at most 132%. That sounds really good to me if I don't need the money. However, a lot of these families that make that decision don't understand that, hey, if I wait till 70, if my benefit was $2,500 over 4 years could be upwards of $120,000 that we're currently leaving on the table in order to get 132%, which means in order for me to recoup the $124,000, how long this way do I have to live and draw my benefit? And the answer is 12 years. Okay? So for anyone in this room, if you're contemplating filing for your benefit early, 66, or later, just know you got to tack on average 12 years to that date. And if you feel comfortable with that, then that's great, okay? Factor 1 is need, factor 2 is health and life expectancy, and factor 3 is strategies. Now, I'm not going to get into the weeds about strategies because there are all kinds of different ones, and it's always a case-by-case basis. But there's a lot of different strategies where we were talking about this earlier with restricted spousal application or your spousal benefit, how we can leverage that out, okay? All right, let's go to the next screen real quick. Spousal and ex-spousal benefits. Spousal benefits are paid at 50% of the full rate, okay? Let's do an example. My wife will be due her own benefit or 50% of my age 66 amount, okay? She won't receive both, she'll receive the higher of the two, okay? If her benefit is higher, then she'll have to draw on hers, okay? But she is due this. Ex-spouses, as long as you were married for more than 10 years and you have not remarried, you can draw on your spouse's benefit at the tune of 50%. Now, you get 50% if you're 66 yourself. One question we always get is like, well, if they draw benefits off of my record, does it affect my benefits or does it affect my current spouse? The answer is no, okay? They're all independently entitled. Now, example, what if I was married to 3 different women and each one for 10 years apiece? Do they all 3 get benefits off my record? The answer is yes. Okay, they're all entitled to my benefits. Well, then they say, well, how does that financially work out with Social Security because you haven't paid that much money into it? It doesn't. Okay, it doesn't matter financially to them. They're just do that. Okay, so again, 10 years worth of marriage that you can draw off your spouse's record. Okay, current spouses, same rules apply. Okay, as long as you've been married for more than 8 months, then the same rules. You can get 50% of your spouse's record if your own record isn't higher. Required documentation is just a marriage certificate. If you're proving ex-spousal benefits, it's your marriage certificate and your divorce decree. Okay? Survivor benefits. If your loved one were to pass away, what do you receive? You do receive benefits under Social Security. The first thing you get is a lump sum death payment. It's issued to your surviving spouse or if you have a child under the age of 18. The lump sum death payment is a whopping $255. It's just a one-time payment. It's actually harder to take that law out of policy than just to leave it in there, okay? If your spouse passes away, you got $255 coming to you at least. It used to be called the burial fund, but they changed that because now that doesn't pay anything towards a burial, right? Also, widow benefits, the way that those can, who receives those is the surviving spouse and any child under the age of 18. The proofs, nowadays, you don't need to really prove anything because when you go to a funeral home, the document goes directly to Social Security, okay? How it's paid, a surviving widow, it works like this, okay? If I'm receiving, let's just say $3,000, and my wife receives under her own record $2,000, and we're both over the age of 66, and if I pass away, she will take over my benefit and hers will drop off. Okay. Now, widow benefits, if we haven't filed for benefits yet, they can start as early as age 60. Widow benefits. They can start as early as age 50 if the widow is disabled. Okay. Now, remarriage. Okay. A widow, if they remarry after the age of 60, then they still have the option to receive their first husband or wife's benefit or their current spouse. But the remarriage has to be over age 60. If they remarried prior to age 60, they have to draw on their current spouse. Does that make sense? Okay. All right, next slide. All right, really quick before we get to Q&A. One thing that happens with Social Security, because I want you guys to leave with this too. The Social Security system is fragmented and it's complex, okay? One thing I want you guys to walk away with, under no circumstance do you ever need to call the 1-800 number for Social Security, okay? I'm not even trying to be funny. Don't do it. Here's why, okay? Usually, most of us in this room will have a situation where we want to know something about Social Security. We'll go on and we'll research it, we'll read through all the information, the material, and we'll get to the point where we say, we have a very specific question. Let me go ahead and call in. What happens is that Social Security, because it's a federal agency, we have to have a front line, okay? Now that front line, either at a field office or on the telephone, are service representatives or teleservice representatives. Service representatives do a lot of great work, but one of the things they haven't done is they haven't gone through a 2-year education about the 2 different types of benefits, okay? That's why when you call in, it is feasible that you get 5 different answers. If you have a question with Social Security and you've already done everything you can to research it, obviously you have us to talk to, but if you ever need to, you need to go into the office or make an appointment and get in front of someone called a claims representative, an adjudicator, the same thing, okay? That individual can help you through your complex case. But if you call in the 1-800 number or you go into the office and talk to one of the individuals in the front, they're going to want to help you, and if they really want to help you, they'll put you back with an adjudicator, okay? But just don't call the 1-800 number, okay? You do a lot better if you just go in and ask to talk with a claims rep, okay? We're going to open up for Q&A, and then we're going to tackle some of these questions.
I'm glad everybody's here. I hope you have some questions, because the more interactive we are with questions, it helps everyone. I'm Kay Quinn, and I'm a partner with Andrew and John, and we're thrilled to introduce Frank and Margaret. They work independently. They work by appointment for just fee-for-service consultation. If you have a situation that you need specific consultation with, their information, if it's not on the slides, we can get it for you. Right now, Andrew and John have mics, and we want to start getting questions out there for you to discuss. If you have a question right now, raise your hand, and John or Andrew will bring you the mic for a question. Nancy does.
Just list something on the 12-year rule that you, in the latter part of your presentation.
The break-even point? Mm-hmm.
Would you mind running through that one more time?
Yeah, absolutely. So remember, if at any point in time, 62, 63, 66, whenever you are thinking about filing for your benefit, on average, it's a 12-year break-even point, okay? Meaning that if you don't draw it at 65 or at 66, from the point that you do start your benefit, then you tack on 12 years to it. Because what's happening is that if you don't draw it at 66 and you want to get that extra percentage increase, we've currently left money on the table in order to get the higher benefit. Okay, so in my example, 66, I could have received $2,500, or I can wait to 70 and receive $3,400. But I've also left that money on the table. So going this way, I have to live 12 years to at least break even. Now, once I get to my 12-year break-even point, I'm not celebrating that 12-year mark. Okay, celebration time is when I get to 13 years, 14 years, because then it was good that I financially waited for this benefit. Now, if we don't feel comfortable health-wise doing that, what we talk with families about is like, well, let's look at your current health, let's look at your family history, and let's look at your life expectancy. Primary family members, mother, father, aunts and uncles, brothers and sisters, is who you can really look at and say, hey, statistically, this is how long I should live. And your doctor could be a good person to talk to about that as well.
One thing onto that, because I think speaking from how many dollars you get from Social Security, yeah, you can do the math and say, okay, I have to live X number of years. There are some circumstances where that 12-year number may change, depending upon if you can do a spousal strategy or a survivor strategy. Mm-hmm. There are even arguments that if your investments can do well, you may want to, if you need dollars to live on and you feel confident in your investments, we could show you how taking Social Security earlier could mean more money in the long run because your investments could stay in compound. So there's some other considerations too, but Frank is really speaking strictly from
the Social Security perspective, right? From an actuary perspective. But he's absolutely right, especially when we start thinking about spousal leveraging techniques. If you can receive a spousal benefit on top of your own benefit, then there may not be a reason to wait. And that 12 years break-even point may be 4 years or 6 years. It's always going to be a case-by-case basis. Great question.
Yeah.
John, is what you were saying, the 12 years that Frank was talking about didn't include the possibility that you could invest that money every year and grow?
That's what I'm saying. We actually could make an argument either way of whether
Yeah.
it's good to take your Social Security as early as possible or wait as long as possible. We always tell clients, if you can tell us how long you're going to live, and then if we tack onto that what your investments are going to do, I'll tell you when to take it. But it is a little bit of a game of hindsight. So yes, I could show you that, yeah, you might receive more from Social Security over your life if you live past that 12-year period and you delayed until 70 to get the max benefit. But I could also show you how if your investments could earn a certain return, well, it's better to go ahead and get Social Security, but now you're taking on more investment risk.
Okay. I have actually a question for each one of y'all. Margaret, this is the question for you. Can you get an HSA in Part A or Part B or anything with Medicare?
No. Once you start drawing, or once you have either part of Medicare, like even if you just get Part A, it's a government rule. You are not allowed to continue to contribute to an HSA or open one up if you hadn't done so already. So any money that you have in it, you can still use it for any qualified medical expenses or the other items that I spoke of, but you cannot continue to contribute. Now, if your spouse happens to have, you come into Medicare, but they're still going to be like on COBRA with the plan that has the HSA. The great news there is can't do the family contribution limit any longer, but you can still do an individual contribution up to the limit. And if you're filing jointly, anybody who's listed on the tax return can be the beneficiary of using the HSA money. So it still has a lot of use.
In anywhere in Medicare, is there an out-of-pocket max, or is it only the deductible that comes into play?
If you're on a Medicare Advantage plan, those plans have out-of-pocket maximums. Remember, they're copay plans, and if all your copays add up to whatever your plan that you chose, that maximum out-of-pocket, then for the rest of the calendar year, your medical benefits would be paid at 100%. The Medicare drug plans work the exact same way on Medicare Advantage plans as they do with just a standalone Medicare drug plan, and that, remember, is a never-ending bucket of money. But there is out-of-pocket maximums with Medicare Advantage. With Medicare supplements, it depends on which supplement you have.
What about like Part A? Let's just talk about Part A. There's no out-of-pocket on Part A?
Okay, are you referring to Medicare Part A?
Yes.
Okay, Medicare Part A has a deductible. That's the hospital insurance.
Right.
The $1,340. So if you didn't have anything but just that Part A, every time you went into the hospital and were out for 60 days, that $1,340 becomes your responsibility all over again. Plus, remember there were some other items that hospital insurance is responsible for. You would incur those costs if there's something additional above Medicare's payment.
It's not like conventional insurance then, where you have an 80-20 once you've met your deductible, and then when you reach an out-of-pocket, it's 100% on them.
Correct.
Okay.
Yeah. But for a lot of people, Medicare is a much better insurance product. Because remember, with that F plan, you're paying your monthly premium, but between those two things, 100% of your medical claims are paid for. So if you had to have cataract surgery, hip replacement, knee replacement, you're not paying a penny outside of your monthly premiums because your health insurance is paying for that.
You just might not get the provider you want.
With original Medicare, that's pretty hard to do. Because in our area, almost everybody participates in Medicare. If you live in Florida, because we have such a high concentration of Medicare beneficiaries, that a lot of providers don't participate in Medicare, or maybe in California. But in our neck of the woods, I don't have clients who tell me that they can't get to the provider they want. You can have that problem with a Medicare Advantage plan if the person you wanted to go to is not in your plan.
That's what I meant.
So that's why you've got to make sure you understand what you're signing up for, and is that what you want?
Okay. And Frank, here's the question for you. Did I hear you say that my wife can get 50% of what I collect for Social Security, even if I wait till I'm 70, if it's the higher of hers? Higher than hers?
She's due 50% of your full retirement age amount. Your
What would have been at
66 amount.
66? Okay.
Yeah, 66.
So
that's what she's due, is 50% of that figure.
Creates another incentive for me not to go beyond 66 for the sake of my wife if her income and her amount would have been lower than mine.
That's right.
Okay.
That's one of those scenarios that you would need to kind of talk through with us and with your experts and say, well, I can go ahead and draw mine even though I don't need it at $2,600 a month, and also my wife would be due $1,300 a month as well because her own benefit is, say, $400. So yes, but it's 50% of your full rate. Now, if you decide to wait to get delayed retirement credits, hers is still calculated off of this figure here. So you're right, extra incentive to take it at 66, but it also depends on y'all's situation.
Got it. Thank you.
In relationship to that question, because I had written that in on my email, the spouse, whichever one, takes retirement at 66.
Mm-hmm.
The other spouse is still working,
Mm-hmm.
not taking it, but they're still eligible for 50% of their Social Security. Is that a correct statement?
That's right, because the same rules apply. Once you get to 66, even if spouse is still working, then they can still qualify for this benefit. Now, just to clarify, and the reason we didn't cover it is because we don't want to get into the weeds too much, but if I'm 66, but my wife is 64, then we're talking about also her rules too, is that if she's working, making over $17,000, yes, she's due 50% of that, but because she's working, making over 17, you won't want to. Also, because if I'm 66, remember that rule about $17,000? That's out the window. It doesn't apply to me, but it does still apply to her because she's 64. So if she's still working, making, let's just say $50,000, then she's not going to be drawing a spousal benefit because Social Security is going to say, well, if you make over $17,000, we want one for every $2 you go over. So it won't be an incentive for her to go ahead and take hers earlier. She'll want to wait to her own 66 to draw her benefit. And remember, everyone, anywhere this way, before 66, you also lock in your rate. Okay, so your spouse, even though she's due 50% of this figure, if she draws it at 64, she's not going to be receiving the full 50%. She's also going to be reduced because of her age. Question?
I just ask one other question about this, which always confuses me. If you're saying that if I want to wait till I'm 70, and how can I get assured 8% return on any investment that's 100% guaranteed? That sounds pretty sweet. But what about my spouse? Her taking it at 66, that doesn't affect me at all. I don't have to start taking at 66. I can wait till I'm 70 to get my full benefit, and she can get the calculated half of my benefit if I had taken it at age 66. Is that correct? In other words, her starting to take it doesn't trigger me having to take it.
Okay, so here's why it gets a little complex. So your scenario was, I'm 70 and she's 66.
Say I want to wait. Say we're the same age.
Okay, so you want to wait till 70.
I want to wait till 70 and get the 8% return better on my money every year, figuring I'm going to live a long time. What implication does that have for my wife who's the same age as me?
If you are currently married together,
yes.
Okay, the thing is that if you file for your benefit, it really opens the door for her to file on your record. Otherwise, she still has to wait for you to file, or she's filing on her own.
She has to wait for me to file for her to get the 50% spousal benefit.
That's right, the spousal benefit.
So if I'm figuring I'm going to wait till 70, then she can't get my spousal benefit, the half spousal benefit. She could just file at some age that seemed advantageous for her based on her
independently
income.
of the spousal benefit on her own record. That's right.
That's
now, that scenario, that's why you have experts, that they would walk you through saying, well, what is the best way to leverage this? Also depending on your ages. If you're 5 years apart, then that's different than if you're the same age. That's right. So it's always a case-by-case basis, but yes.
Yeah, isn't there before full retirement age, isn't there a one-time option where you can begin pulling Social Security? But if you go over the year, then you're stuck with that rate?
Absolutely. Great question. I'm glad you brought that up. If you were to trigger your benefits and you started them at 64 and then 3 months down the road, you're like, oh man, I shouldn't have done that because I just got this job that pays me $200,000 a year. Okay? Say that happened. Well, you've already triggered your benefits and you know you can only make up to $17,000. If it's been less than 12 months, absolutely correct. If it's been less than 12 months, you can start over. You can hit the reset button. Okay? I'm not going to lie to you. It's a little hard, but it's feasible. Now, if you've been receiving benefits for more than 12 months, it's a no-go. You're locked in. Okay? That rule came about 5 years ago with Social Security because some individuals were drawing their benefit at 66, getting $124,000, and then at 70 they said, you know what, we're going to cut you a check back for all that money and then reset me at 132%. And they said, well, no, we're not going to do that anymore. Now, if you've started your benefits and you've been receiving it for more than 12 months, you're stuck with that decision. If it's been less than 12 months, you can hit the reset button.
Yeah, you have to pay it back.
You do have to pay it back, yes. So if you received it for 3 months, you pay back the 3 months.
And to add on to that, that's why you need to be extremely confident in the choice you're making because, if you get different answers, you might make one choice that you think's right, and you may not revisit it for 12 months to realize that you made the wrong choice. So it is very important to research what you're going to do.
And it's not easy. And I'm telling you, I'm the expert. It ain't easy.
Would that be if you took A, B, N, C, or D, or if you only took A?
Oh, yeah, your benefits are completely kind of independent of how Medicare works. Yeah.
Excuse me. I have 2 questions. I've had to file for disability at age 61 and have to get a stem cell transplant when I can, if I can. But in the meantime, I can take that and only make $14,000 per year, is my understanding, to get that benefit. If that's successful, and say in the next year and a half and I'm able to work, does that $14,000 rule stay in effect forever? Or if I'm healthy again, does it revert, or can it go to the age 66 full retirement?
Great question. So if you're receiving disability benefits under the Social Security fund, then yes, you are capped out of receiving, you can only make up to $1,000. However, when you reach age 66, your benefit stays the same, but it no longer says disability on the top of it. It's retirement. So once you get to 66, if you got better and you want to go back to work, you can absolutely do that.
Okay.
But that's at 66, so it does reset at 66. Great question.
The example a few minutes ago about the spouses that were 70, what about in the case of divorce?
Absolutely. So divorce, so as long as you were married for more than 10 years, the same rules apply as current spouse or ex-spouse.
So is it, if I understood it correctly, and I may have misunderstood, the wife had to wait until the husband began to draw?
I'm glad you brought that up. On ex-spouses, no. Independently entitled ex-spousal benefits. So if ex-husband is deciding to wait for their benefit and I'm the ex-spouse and I'm 62, I can go ahead and draw. That would be really bad for the ex-spouse if they couldn't draw their benefit. So yes, for ex-spouses, no, it doesn't. You don't have to wait for that other person to file. The only rule for ex-spouses is that the other spouse has to be 62 at least.
They try not to make ex-spouses talk to each other and coordinate.
That's right. That's right.
If you are someone who takes many medications, do you recommend that somebody meet with somebody like you? Or, I mean, I don't know. I do take insulin, so I don't know where I fall into that need.
I mean, that's a hard question. I don't want to say, oh, yeah, you need to call me. A lot of times people will ask their pharmacist if they can recommend a plan, but, it is so important that you get the right plan.
Right.
And you want to make sure that it's a plan that covers your insulin, because here's the thing about Medicare drug plans. They have to cover medications in every classification, but they don't have to cover all of them. And that's why we have so many plans, because we need to find one that has your list, that it's all covered, and we want the best benefit that you can have.
Now, is there somewhere where I could go and look?
You can. You can go to Medicare.gov, and you can, on the home page, it will say find a Medicare drug plan or plan finder. And you just click on that, and it walks you through the steps, and you put in all your medications, and you can tell it what your preferred pharmacy is. And I like to set the parameters so that it's going to give you the lowest out-of-pocket plan first on the list up to the highest. But the other things that you want to look for, even if you click on the very first one, there are restrictions on Medicare drug plans. So the same thing that you would encounter on another plan outside of a Medicare drug plan. So there's prior authorizations, there's quantity limits, and there's step therapy. Now, quantity limits is not that big of a deal. If you're taking one a day, obviously you're within the quantity limits. And for some medication, it's commonly prescribed for 2 a day or 3. That is not hard to get around. Your prescribing physician just has to say, Mary needs 4 a day. And there's usually something in your medical record that can document that. Some plans will make you have a prior authorization to be able to get your medication. That's when you might want to go to the next one on the list and say, is this plan going to make me get a pre-auth to get that? Pre-auths, again, aren't that big of a deal. Usually we can get a physician's office to help, but the prescribing physician always has to get involved. Step therapy is the one you want to avoid at all costs. Step therapy means that the insurance company says there is a less expensive medication out there that you have to try and fail before they will give you the benefit with the medication that you're being prescribed. If you've already tried and failed the medication, then all your doctor has to do is submit that information, and then you're going to get that with the benefit. But if you haven't, you may never get it. And so that's where it can be kind of dicey. So you just want to pay attention to the restrictions. Mm-hmm.
I have one question, and it's for Frank. It's about, there may be some people in this room that are still fall under the ability to use the restricted spousal benefit, or even take half of the spousal record and delay theirs until age 70. Can you speak to that and the ages that affects?
Absolutely. If restricted spousal application, which is different from those of us who know what file and suspend is. File and suspend is no longer law. We don't really need to talk about it, but restricted spouse application is still a leveraging technique that spouses can use. The way that works is that if you were 62 before January 1st of 2016, then what can happen is under a restricted spousal application, someone, husband or wife, draws their benefit. The spouse reaching age 66 can draw 50% of the spousal benefit and let theirs continue to grow. Again, it's got to be where the spouse has to be 62 prior to January of 2016, and then one of those spouses has to be drawing the benefit. Great question.
Unless they're divorced, and then
if they're divorced, then they can still file their benefit. It doesn't matter if husband or wife are drawing their benefit, correct? And that's restricted spouse application, and that is a good amount of money that would actually reduce, again, that 12-year break-even point. Right. Again, that's a case-by-case basis, but yes.
So with regards to that, let's say your spouse is younger, you hit 66.
Mm-hmm.
and they're claiming at 64,
Okay.
for argument's sake, does their claim then, when you hit 70, stay at the 64? They're half of your 70, or your 66 then?
Yes. So a couple of things that happen if anyone, husband or wife, files before 66, whatever that percentage reduction will follow them when they file for a spousal benefit. And again, for spouses, husband or wife, do not take advantage of these delayed retirement credits. Okay? So if I'm waiting until 70, even though my benefit looks like $3,400 a month, my wife's benefit is still locked in at that $2,600. Okay? Just because I waited, it won't transfer over to her. The only reason it ever transfers over is in the case of a widow benefit. If I was receiving $3,400 and she's receiving $1,300, then yes, she does take over the higher of the two figures.
And the 2,600 then would be at her reduced rate because she started receiving
Early.
her benefits early.
That's right. Mm-hmm.
And we see that quite a bit with older spouses that want to wait until age 70, and they may have a younger spouse that may not have a great benefit. That age 70 benefit would go to the surviving spouse. It's another planning technique.
Right. Again, it's always a case-by-case basis, because if there's like a 15-year gap, then yeah, it may be better to receive the 132% because we're looking at a widow benefit as opposed to a current benefit since there's a 15-year gap. Great question.
Another question regarding working and drawing your benefits. Isn't there a certain time period where your benefits are decreased $1 for every $3 if you exceed $44,000 salary?
Yes. So the rule that she just mentioned is the year that you turn 66. Remember, if I told you that if you draw any time before 66, you're subject to only being allowed to make $17,000 and not affect your benefit? The year that you turn 66, let's say my birthday is August the 16th, but I wanted to draw my benefit January of the year that I turned 66. That rule comes into play. Remember, it used to be $17,000. The year that I turned 66 or my full retirement age, I can start my benefit at the very beginning of the year, but I can only make up to $44,000 between January to the last day of the month before I turn 66.
So Frank, people that have birthdays earlier in the year benefit from that rule probably a lot more than if your birthday's in October, November.
Because if my birthday's in February, I can start my benefits in January. I won't receive the full 100%. I'll be receiving 98, 99%, but I can start it early. And as long as I don't make $44,000 in that 1 month, then I'm good to go. And the whole 1 for $3, remember how I told you they charge 1 for every $2 you go over the $17,000? The year that you turn 66, it's 1 for every $3 you go over. So again, if my birthday's in August, but I want to draw my benefits in January, I can make up to $44,000. But if I go over $44,000 between January through the last day of July, if I make $50,000 in those first 6 months, then I can, it's 1 for every $3 you go over. So whatever you went over divided by 3 is what you'll need to pay back. But that's only the year that you turn 66.
And that's earned income as well as investment income?
Just work income.
Just earned.
Earned income. Yep. W-2, 1099. 1099 is work income.
Or independent contractor income.
Right. Question?
If I could, Margaret, paint a real scenario for you and see if you can help me get an answer on this.
Okay.
So I'm 64 right now. I'll turn 65 in August, and my intention is to fully retire by the end of this year. I have health insurance with my employer, and my wife is also on the plan too. Mm-hmm. If I understand this correctly, if I when my birthday happens in August, I have to start Social Security, or I can wait and file for Social Security January 1. I've got to have something in place on January 1 for myself.
Okay, are you referring, when you say Social Security, that triggers retirement benefits?
I'm sorry,
do you
not
mean
Social
Medicare?
I meant Medicare,
okay.
yeah.
I just want to make sure we're talking about the right thing.
Right.
So So your question is, do you have to sign up for Medicare by your 65th birthday? And the answer is no, because you are in that scenario where you can defer because you are actively working and
Right.
covered under an employer group health plan. But I heard you say that you might be leaving in December.
Yes.
So that's where, remember when I said, depending on what month you sign up, it triggers your effective date. So now I've got to, with your help, we're going to have to figure out if you waited. So if is your birthday August?
August,
Okay,
yes.
so then September, October, November, would be fine. The initial enrollment period always trumps the special enrollment period. So when people, this happens all the time, when people turn 65, but they're going to wait till the end of the year because December 31st is just neater and cleaner. Let's start
Right.
January 1. If the last 3 months after your birthday come in that last part, like November or October, November, or December, then it pushes out your effective date. There'd be no way we could make your effective date coincide with January the 1st. And I don't know why Social Security made that crazy rule, but they do. So if you're, I'm gonna make a different birthday month. Let's say your birthday was in September. If you wait to sign up in September, then your Medicare is effective October 1st. If you wait to sign up October 1st, it pushes it out 2 months. So that's going to be December 1st. If you waited till November, then it's going to push it out 3 months. So then it's December, January, February. There's no way to make it sync up January 1st. You see what I'm saying? In your case, it wouldn't matter because you've run through your initial enrollment period and then you'd be in the special enrollment period. And that's when we need to get you the form, the L564 form that your employer fills out and you take to the Social Security office and you get to tell them when you want to start.
Now, if I do that, does it mess up my Part B thing? There was something you said about that where they could ask medical questions or something?
Oh, no. Okay, so when you first come into Medicare and your Part B is effective, you have 6 months. Let's just say you decided to wait. You're like, I'm busy, or life gets in the way, and you haven't signed up for a Medicare supplement yet. You have 6 months from the effective date of your Part B to go sign up for a Medicare supplement, and they can't ask you any medical underwriting questions. But if you waited until the 7th month, you're going to have to pass medical underwriting to get a Medicare supplement.
So in your scenario, you're gonna start your Medicare. If you turn 65 in August,
you can
and you
sync it
wanna
up
wait till January.
Well, the reason I want to do that is because my wife depends upon the insurance.
That's right.
And if I, went to Medicare, she'd lose insurance, and
That's
she
right.
needs it.
But like Margaret said, you'll fall under special enrollment. You can start your Medicare January 1.
So that's great. It's just sometimes people say, what do you mean I can't make it start in the month that you need it to start? And it's just this strange rule that they have. Now, what about your spouse? Well, can she do COBRA for 18? Well, I mean, does she turn 65 within 18 months of you turning 65? Okay. Okay. Right.
I've got one more quick question, and that is, if someone is part of an HSA, and they're 66 and they want to take benefit, can they continue to contribute to the HSA?
No.
Does being on Social Security automatically prevent you from contributing to the HSA?
It does, because when you sign up for your Social Security retirement benefits, you will automatically be enrolled in Part A, and there's nothing you can do about it. Even Frank and I went through the regulations because I was like, this doesn't make any sense. But we can't fight City Hall or the government on this one. We've tried. So you will get a Part A card, and as soon as you have that, you no longer can contribute to your health savings account. Any money you have in there you can still use, but you can't continue to put money in the account. That's a great question.
Signed up for Part A, but in less than 12 months, you could opt out of Part A and still go back.
If you, I do have this happen. There's, if you, you would have to get a Medicare termination form. I have some people who come into Medicare. Well, Coach Philip Fulmer is one of my clients. And he went into Medicare, but now he has a new job. And so he said, I don't want Medicare because it's frightfully expensive for him. And obviously UT will pay for his benefits. So he said, what do I do? And so we got him the Medicare term form, and it terminates he's not drawing Social Security retirement benefits, so he can get rid of his A and his B, and he could contribute to a health savings account.
Okay.
One final
Yeah.
question. You all have your contact information here, but if we have, where's the place to start? Do we call Quinn Financial and then go to see Margaret or Frank, or how does that work?
You call them directly. We're just facilitating this event, but yes, I would call them directly. They're the source of answer for your specific questions. I'm sorry? Business cards?
I brought some, and really quick, I just wanted to that point, the way that we kind of work, we want to make sure that we can actually help you. If you're already on the right track and you're doing the right things, then we may not need to do a consultation. At least that's the way with FedLogic. We work a lot with employers, so we do this just because of our friends here. So if you need us, contact us. If it's something we can answer really quickly, we just want you to get the answer. If it's something that we say, hey, we need to really do a lot of work or get you informed and do all this, then we'll do a consultation. So, yeah, I brought business cards, and I think that on one of the slides has our information. If y'all can slide to it.
Yeah, the last slide has their email, their websites, their
and I have cards back here if you guys want to stop by. We also have a newsletter. We don't send out a weekly newsletter. It's every quarter. But if there's anything that I hear coming down from Washington or from headquarters in Baltimore with Social Security or Medicare, then we like to keep you guys informed. If there's any big issues, like when we had file and suspend leave back in 2015, we were on the bullhorn telling everyone, hey, make sure we get grandfathered in, or do this or do that, or this age group needs to go ahead and act on this. If there's anything like that, we'll shoot out a newsletter to everyone on it. So I did bring a pad if you guys want to give me your email address, and we'll send it out to you. Oh, there it is right there.
All right, one more.
I have one really quick question. I've not heard anybody mention dental coverage, dental insurance coverage.
Okay. Medicare Advantage plans, some Medicare Advantage plans will include dental or vision. Now, typically you have to use whoever is in their network, and it can depend on which option you choose. Typically with Medicare Advantage, there's several options to choose from, and that can determine the amount of your benefit. Outside of that, if you're with Original Medicare, there are some dental plans that are available. It really comes down to if your dentist participates in those plans. If you have a dentist that doesn't participate in them, then it really isn't worth the premium. And you're much better off just doing a deal with a cash price. And the vision plans are somewhat limited. Blue Cross has a vision plan that you can purchase. Humana does. Delta Dental, if your dentist participates in Delta Dental PPO, there's 3 different platforms. There's PPO, Premier, and Premier Plus. But the majority of them are in Premier and Premier Plus. And if that's the case, it just doesn't do you any good to sign up for the PPO because you will always be balance billed. And they're expensive, the premiums. I mean, they're about $40 a month for an individual. So, good question.